We're going to go ahead and get started. It is noon. Thank you so much for joining us for this information session. This is an info session on the Chicago Schweitzer Fellows Program. My name is Maya Bauer. I'm the director of the program here in Chicago, and looking forward to kind of getting to know you all a little bit and also telling you some information about this program. First and foremost, we are here for you. So if you have questions or if there's something you really are here to hear about, let us know. Don't be shy about that. Chances are, if you have a question, somebody else has a similar question or the same question that they're too shy to ask or have not taken the time to think through. So be sure to ask us. We're happy to talk about it. We have a graduate of the program on our call today. We're really excited to have her talk to us a little bit later. Please stick around for that part. And in the meantime, I'm going to go ahead and get started. In the chat, I've put some links. There's both a Google folder that has some documents in it, including the application itself, some FAQs, some information about guidelines for applying. Those are all good pieces to take a look at if you have some digging time. There's also our website link that has info sessions. You obviously found that or found this through an email, but it also has the application and some other information about the program. So feel free to dig into that. That's in the chat. Let's see. Okay, so to give you a sense of who we are, what we're about, give you a little bit of history. The Schweitzer Fellows Program in the US was formed about almost 30 years ago. And the idea was to cultivate a cadre of health professionals, folks who were interested in improving health equity in the US, in cities and locations around the country. There are currently 13 active chapters around the country. We're excited to be one of them. We are currently the largest chapter, and we've been around for 24, almost 25 years. We're going into our 25th year next year. We're really excited about that. We also have an active alumni component here in Chicago, and that's something we'll talk about a little bit later. In Chicago here, we're located at a nonprofit called Health and Medicine Policy Research Group. It's an organization that works on health equity through workforce development and policy, and that's pretty unique and exciting for people involved in this program to have a connection to policy and to the bigger picture of health and health equity and public health in Chicago. This program is named after Albert Schweitzer. He was a humanitarian many, many years ago. And initially there was a rotation for only medical students from Boston who would go to a hospital that he founded in a part of Africa that is now Gabon. They would go there, they would do service, they would come home. One of those students came back and went to his neighborhood and said, let's do this here. Let's do it in the US. We have health inequities at our doorsteps. Let's bring this to our cities around the country. So that's how it started, and it's continued to see the birth of a big group of alumni who have dedicated their lives to a commitment to service and to being leaders in that service. So we're excited that you're interested in joining that cadre. So what is health? So from our perspective, I know the World Health Organization has just gotten a lot of visibility in the past year. So that's exciting for us because we've always loved the World Health Organization. And for us, we really identify with their definition of health being every part of a person's life. So everything in a person's life that can impact their health is part of the definition of health. So it's not just an absence of infirmity. It's not just not having a headache, right? It's being able to prosper and thrive. We have a lot of inequity in Chicago. Some of you may not be familiar with Chicago. Actually, if you could put in the chat, where are you originally from? What's the city or country or state that you're originally from? We got a Chicago suburbs, love it, another suburbs, that's great. Washington, DC area, Portland, Oregon, great, wonderful. Croatia, I love that. The Loop, right downtown, wonderful. So we have even from that cross section, you can see that people are from all over. So we like to highlight in this conversation the fact that Chicago has a pretty vast inequities from neighborhood to neighborhood, but also just a high level of poverty overall, and that's concentrated in Black and brown neighborhoods, disproportionately so. And that, we believe, is not because people in those neighborhoods are deficient in any way or have done anything wrong, but the system has created inequities that have made that to be the case. And that's something that we are actively working against as an organization, and we believe is unjust. But we also want these projects that we're thinking about in this fellowship concept, right, to be looking at some of those issues, some of the issues that make health outcomes different in different neighborhoods. The life expectancy gap is more than a decade. So life expectancy, how long you live, right? So from neighborhood to neighborhood, that can be more than 10 years difference in Chicago. That's pretty amazing and astounding and terrible. We have some good resources we want to recommend to you. I'm having trouble copying and pasting from my notes, but I will attempt to do that in a second. Things to look at in case you're interested in what kinds of health issues are priorities. Obviously, COVID is one that we are all well familiar with right now, but there are also many others that folks are really interested in tackling. And we have a few resources in case you're interested in what kinds of things might be a good fit for our program. I'm gonna go ahead and everyone. This link is for Healthy People 2030, which is the national priorities for health interventions and health, so as a country. Chicago has done a version of that for our city as well. So if you're not from Chicago, as some of you aren't, or you aren't familiar with this, it's another great resource to take a look at what is it that Chicago is really trying to focus on. And that's called Healthy Chicago 2025. That's a plan that the city is working on. And it's not just the city, like just the officials hired by the city. It's a big group of organizations and stakeholders who are making that. So those are really good resources if you're interested in developing ideas or thinking about what kinds of issues to focus on for this fellowship. And also just in your work in general. So those are in the chat. The idea is that for this fellowship, you create a project, right? You create a project over the course of 13 months. It has to, in some way, work with a community organization and target a community or a set of individuals who are underserved in some way. Now that's open to interpretation. And we'd like to hear in your application what that means. Like, what do you think that means? And what is your argument for the kind of project you'd like to do and the population you'd like to work with? But typically we see low income, uninsured, underinsured, some sort of ethnic minority group, immigrants, folks experiencing homelessness, that sort of thing. So that the folks that you're going to work with have to fit into an underserved population category. Some fellows choose to work with a community that they have a connection to in some way, personally, or that they have had some experience with. That always helps us to understand, why they've chosen that group. But you can also work with any group. Projects are a chance for applicants to think creatively. So you have to think about using the resources you have, working with an organization and leveraging their assets, their resources. What is it that they have that they can use to improve the life that they have and the health that they are working with? Can I have in the chat, what is it that that generally when a nonprofit or like a government is trying to work with a community, what are they generally trying to do? What are they trying to accomplish in those communities? Some examples. Or some problems that they've found. What are some examples of things that they tend to target when they're trying to work in communities? There's no wrong answer, so don't be afraid to pop something in there. Access to healthcare, disparities in funding allocations, redlining, disparities, education, right. So what we see in lack of transportation, these are great answers. What we see a lot in the way that we've framed working with communities, and particularly with underserved communities, is that we see this language from nonprofits like we are, from the government. There's a lot of language around what's wrong with the community, right? What's lacking, what's missing? Are there bad schools, right? Is there violence? These sorts of things. And that's all useful to be studying and to be thinking about. We also in this program try to equally focus on assets and strengths. So we think about, okay, this community has suffered a lot of violence, but they also have great cultural centers. Last night, we took our students in a socially distanced, safe way, our current class of fellows, to a cultural center to do an event. And so that's the places we try to look at. So when we're talking about working with communities, we're looking at, yes, the lack of transportation or the violence, but we're also looking at what do they have and what are their strengths. So maybe they have a whole bunch of people who are really good at sports, and they can put together a program around those people that focuses on the strengths and the assets that are already a part of that community. So that's a reframing that we do it in this program. Oops, I did not mean to scroll, so I'm going to scroll back. You ready? Do we get there? Projects are a chance for students, for selected fellows, to think creatively and work alongside communities. So it's not about fixing anybody else. It's not about charity. It's about doing work that is meaningful alongside people and making change together. We often hear things like, I gained as much from this work as I gave, right? And that's important. Can anyone tell me what the social determinants of health are, what that phrase means? I know at least Olivia knows, but probably somebody else has heard this phrase. You can take a random stab in the dark too. Social determinant of health. Socioeconomic status, culture, ethnicity, etc. Olivia, who is our fellow for life, our graduate of the program, says everything y'all are saying. Yes. So when we typically think about interventions, right, and a lot of the kinds of programs that we're going to be in health and helping professions, a lot of the times people are talking about, well, okay, we want to make a program to get people to change their behaviors, right? Like we want to get people to really eat better because that will change their health. And that is true. We're also trying to think about what is it about the social structure, the atmosphere, the environment, the government, the policies, the money that created a system in which that person had poor health, right? And so that's the social determinants of health. The circumstances and social conditions in which people work and go to school and live every day. And that's as important, actually much more important than their choice about which thing to eat for dinner, because that is influenced by all these bigger picture issues. So we talk a lot about the social determinants of health and the structural determinants of health as well. So the policy, the government, all that stuff in this program. And we want you to continue to think about that as you're thinking about community work. So what are the projects, right? In projects, we'd like you to develop with your community organization, your chosen group that you're going to be working with, a project of some kind. Now, as we said, health is defined broadly. So it has to be something that improves health in some way, but since health is everything, right? It can be almost anything. And we encourage you to be creative with this. We want you to do something that is exciting to you, that's meaningful to you in some way, that inspires you, that makes you want to go and do this work. A lot of what this is about is getting out of the structure of, studying and taking a test and connecting to the reason this kind of work inspired you in the first place. What made you want to go into the field that you're studying to be in? And that often has a lot to do with either helping people or being connected to people. And the way that we do that is by working with community. So projects can look a variety of ways. They can be literacy, tutoring, working with kids, teaching English, all these sorts of things. They could be health literacy or financial literacy. They can be violence prevention, self-esteem, mental health, dance. We have all kinds of, the list is very long of the kinds of projects people have done in the past. And we think that's really exciting because we want to see people being creative when they're thinking about health and they're thinking about working with community. It's not one size fits all. It's not even one size fits most. It's whatever thing that inspires you and that you feel drawn to, think about how to incorporate that into improving health. And I want to see if you have questions, please put them into the chat at any time. As I said at the beginning, I want to make sure that we're answering people's questions as much as I'm getting through the slides. The slides are not that important to me. Your questions are important to me.
We do have a question.
Great.
So from Trisha, she asks, how has COVID-19 shifted expectations of fellows with in-person interventions?
That is a terrific question. So we're in the middle of an international pandemic. I just wanted to let you all know, in case you hadn't noticed this fact, which you all have, it has shifted expectations quite a bit. We have 10 to 12 of our current fellows. So each class is 30 fellows. This year we have 28, and 10, I believe 10 of them have been approved to do some kind of in-person work. So what that's looked like is that they've had to get permission from our advisory council, who are clinicians, who are doctors, who are in charge of medical systems. They've had to propose a safe way to do in-person work and then get that approved. The reason for that is we want to make sure that we're keeping everybody as safe as possible, but we also didn't want to preclude in-person work because there is a lot of need out there in our communities still with the pandemic. So we didn't want to only make it so that folks could work virtually because, for example, a street medicine program working with homeless populations doesn't work virtually. You can't say, hey, get on the Zoom at 10, we'll check your blood pressure. Like that doesn't work. So we needed to be flexible to make sure that our students, if they could work in person, were able to do so. I hope that helps.
And then there's one more question. Could you talk about how fellows in the past look for academic supervisors?
Absolutely. So maybe Olivia can answer this, and then I can chime in. Is that easy for you?
Yeah, it's super easy. Well, not super, I should say. But what I did was look for a professor in my program that seemed like they could be involved and they would be a good support. So like, for example, at Benedictine, the professor who was teaching the health education classes, she also was running the IPHA like student section, and that's why Benedictine has a relationship with them. And like, she was very involved in community work in general. She had a lot of projects going on with students, so she was just like a natural fit. So it may not always be that easy, but you can look for professors, even if they're not directly your professor, but they're in that department, whatever, to see if they have some interest in supporting you, or they have research and community work, or whatever the case is. So I just kind of looked for that, and she just happened to be there. But you can be very transparent, and some professors might want to be involved and they're not even your teacher. So yeah.
Thanks for your answer.
That's a perfect,
sorry.
No, you're great. That's a perfect answer. I'll just chime in a little bit more to say it has to be somebody from your current academic program. That can be a little tricky if folks are in their first semester in that program. They don't have relationships built. The good thing is that we have relationships built with most institutions around Chicagoland, so folks have heard of us. and they're familiar with the program and sort of the expectations and some of the demands. It's a pretty light lift for academic and site mentors, so people are often interested in being involved because it's an exciting chance for them to really be involved with community work in ways that a lot of folks really like to be. But it has to be somebody at your academic institution. That's a good question. Did you have any follow-up, Jessie?
Yeah, I did. So I was wondering if Olivia in particular, if you could comment on whether or not you had kind of cold emailed someone that you were interested in having as your mentor, or did you know someone who knew that person who's maybe helped a fellow get in?
I cold emailed her. So like Maya said, I should have said that, but they should be in your program. But she wasn't, I should say she wasn't directly like one of my professors, but she was in the program and she did health education. And like I said, she did a lot of other community research. So like, I just knew of her because we would get like public health emails, and being a part of like the IPHA student section, she came up. So I like cold emailed her. I'm a big fan of cold emailing because sometimes you don't, yeah, because sometimes you don't think that people are interested, but they actually are, or they actually pride themselves in students coming to them and wanting to kind of do something outside of your general academic work. So yeah, I cold emailed her and it just happened to work out. And I kind of also stalked her a little because she is a little busy, but I'm not necessarily saying to stalk her or to stalk whoever you want, but like, if they're busy and you kind of want to get their attention, you can like schedule office hours or something.
Yeah, sounds good. Is there a list somewhere that has mentors from different institutions that have helped fellows get into the program?
That's a good question. We do not have a list like that we distribute, but we do have internally all the past mentors. So if you want to be in touch with somebody from your specific institution, we can put you in touch with those past mentors. And sometimes we'll have folks on our advisory council or on the board of directors of our organization who are located at institutions who can also help find you a good fit.
That would be awesome. Thank you.
Yeah. Great questions, everybody. Thanks for those. Okay, so now we're going to talk a little bit about the fellowship, right? So it's a service learning program for graduate students. You have to complete 200 hours of service. 130 of those must be spent in direct service. That's a little squishy this year, but generally that's the norm, that's the standard. The reason for this is that we're not doing a research project. We're not, that's not the aim of this fellowship. So we really want folks to be focusing on direct impact. We have a community site guide because we do require that you're doing this work in partnership with an existing community organization. So if you want that site guide, it has over 100 organizations in it that have either worked with us in the past or expressed interest in working with us. The nice thing about that guide is that it also has some examples of past fellows projects that existed at those sites. It doesn't have like their full contact information, but it gives you a sense of the kinds of projects that have worked well there and that might work well in the future or might give you a jump off point, right? So if you're interested in that, it's not on our website because it's a big document and we're continually updating it, but you can email us and we'll send it to you. We are interested in projects that are helping underserved populations or communities in Chicagoland. Again, the social determinants of health are important to us. There is a $2,500 stipend that is associated with the fellowship that is paid out throughout the course of the fellowship. And the question is about if the project can be more administrative. That's a great question, and the answer is generally no. We are working on, we're focused on working with directly one-on-one with the community. So that does involve some administrative work to create that programming, but we want the programming itself to be direct impact work. That said, sometimes we have train the trainer models that have worked really well. So you'd be working with community to maybe teach how to do something. We have, for example, community health worker initiatives where we'll have fellows working with a subset of folks to develop their skills so they can go out and work one-on-one with community. Those sorts of projects do work. So there's some flexibility in there. Now we're gonna turn it over to Olivia. That's Olivia. She's gonna give you a sense of her project, but also her experience with the fellowship. Then we're gonna give you some more information about the different aspects of the fellowship program.
Hi guys. So first I'll preface this by saying I had a couple, there were hiccups. Community work has hiccups, and I ended up, I started out wanting to work with the Boys and Girls Club. Their programming and everything just didn't allow for time at that moment. So then I ended up at the McCormick YMCA, which is near Humboldt Park, and I worked with Latinx and Black boys, particularly on positive health discussion. So I called it Project PhD. And essentially, I gave them a space to talk about mental health things that they had going on, or we did stuff around physical health. I took them around the community, and I really wanted them to understand that where they were doesn't have to be where they end up. I wanted them to feel comfortable. As we know, a lot of spaces in Chicago, especially communities, are being gentrified. And so the youth that were there, I wanted them to feel comfortable still in their community. One activity we did in particular was I took them rock climbing. Now, this rock climbing place was literally down the street from a lot of them, but they didn't feel comfortable going in because they're like, I don't see anybody that looks like me there. So I had them go in. It was a physical activity. I would make sure they had after school snacks and things like that. So that's more of the logistics part, I guess, of what I did. But my project as a whole, I really enjoyed it. So as we know, like Maya said, you want to partner with a community organization because it kind of makes it infrastructure wise to me a little easier, but it also teaches you that community organizations, as much as they want to do so many things, they have their hands tied. So I was actually put with their youth safety and violence prevention program, and that's where the why they got grant funding to do this program, and they couldn't do as much as they wanted to do. So they were happy to have a fellow come in because it was like I worked with them and I was able to have a little bit more, I guess, flexibility in terms of programming and still work with the youth and still hit the goals of their programming and also hit the goals of Schweitzer. As the fellowship as a so that's a little bit about my project. I can go into depth about how I switched. If you want to talk more, like I'm open to sharing my email, Maya. So if any of you guys have questions, just email me about how I kind of navigated like switching spaces and like how I, like the back end of everything. But just as a fellowship as a whole, I really actually appreciated it because even outside of your project, you get to be with a group of people who are from different sectors in the healthcare field. And that really, I actually valued that a lot. I love my project, but I valued that a lot more because some of us, it feels like we get siloed. So like being in public health, especially for me, always public health, health departments, whatever, like my normal day job is like child health, public health stuff. So it was nice to work with doctors. It was nice to work with, or future doctors. It was nice to work with future social workers, nurses, whatever. And we kind of learn from each other. So you have like monthly meetings. I also really love that at our monthly meetings, we had speakers, and some of those speakers like you can connect with and you can learn more about their experiences and everything. So Schweitzer kind of offers a lot. Like you don't just go in and doing these projects, you go in and you get community, you get to network in the best ways possible. And yeah, I don't know. It's like just something about it. It's hard to say. And it sounds like probably a cult a little bit now that I'm talking. I was like, you get to meet these people. It's like, now we're together. But no, in all seriousness, it's just a cool space. Maya, I adore her. Angela, I adore her. Rachel's on here. She's part of health and medicine. You get to meet some cool people and be involved in a cool activity. You learn a lot about community work and being on the ground too. You learn so much. And it's a lot of stuff that you could take into your professional life and your studies. And to be honest with you, anytime you'll tell people that you were involved in the Schweitzer Fellowship or the project, people are like, oh my gosh, like they just get, I would say for me that I would just hear excitement because they realize that you're really passionate about what you want to do. You're really passionate about helping the community that you wanted to serve. You're really passionate about just being in the health space in general, wherever you may fall into that. And yeah, so I know I bounced around a little bit because I don't want to take up too much time. I could tell you so many things, but again, if you want like specifics about my project more or about my experience at the meetings or some takeaways, like definitely shoot me an email and I'd be happy to help.
Thank you so much, Olivia. That was great insight into both your project and sort of your experience with the fellowship. So it was really useful. We always love to try to get an alum on here because, you know, this is, their words are as important as ours, maybe more, about what their experience has been like. So definitely take her up on that offer and send her an email if you have a question or if you want advice. What she said about connecting with other people with the network is really true. There's such a vast network in Chicago. And if you plan on having a career here or otherwise, having the connections is really a lot of what that's about. And so starting to make those connections is really important. And our program has a really wide network. So we encourage people to take advantage of that and to continue to build on those connections. There's a question about pharmacy, well answered. Yes, we have pharmacy fellows most years, and we really appreciate what they bring to the fellowship. So we're always glad to have applicants from pharmacy. So Olivia touched briefly on a few things, including monthly meetings. So in your fellowship, you are conducting a project, right? That's the meat of your fellowship, is to do a project. You go out, you design a project, you work with the community organization. You also are in this cohort, right? You're here with 30 other people from around Chicagoland who are having vastly different experiences, learning things. And so we meet now virtually, but generally in person. And we bring in speakers to talk to you about different, for an example would be somebody from the Chicago Department of Public Health. And this is not just pandemic related. Normally we do this. We bring in the epidemiologist there. Now everyone knows what an epidemiologist is, which is great for this conversation, but the data guy, right? He comes in and he talks about the data of Chicago. And that's really cool because a lot of us come into these kinds of projects, even if we're from, you know, we had some suburbs of Chicago folks and so forth. But even if you're from here, there's a lot to know about what the data tells us about health disparities, what it tells us about what's going on in the city in general. So it's exciting to know that. And they really dig in deep. They're really smart and they really give us history and context. If folks have left the city, how that's impacted the conversation as well. So that's the kind of speaker we bring in to really enrich both the fellowship experience, but also your experience in graduate school, right? What it is that you're learning. These speakers map on top of that experience. They help you understand the things that you're learning, as far as like if you're learning about a disparity, now you'll know the context and the history of it. So that's one example. There's many. We have meetings almost every month, so there's lots and lots of folks that we bring in and we kind of get that richness. We have some other trainings and events throughout the year that are an exciting way for us to connect to each other and to the larger network. There's a strong mentorship and networking aspect. So I know one of the questions was about mentors. You have to have a mentor that is at your site, a mentor at your academic institution. We assign you a mentor, somebody who is recently graduated from the program to help you understand the fellowship better. And then we also have our program staff that are here to support you. So there's a lot of mentorship involved and that can really help you grow, but also grow your network. If there's questions that Olivia is not answering or that I need to answer, please let me know. I want to keep an eye on that. I wanted to just, this bottom left-hand corner, the interdisciplinary groups. So The interdisciplinary aspect is a really important part of this program. It's something that most programs don't really give you, and it's where we're moving in healthcare, and not just healthcare, but in care in general, right? Sometimes we have fellows who are law students and so forth. So it's not just about nurses and doctors, although we love our nurses and our doctors. It's definitely about the bigger picture of public health. Working together is more and more seen as the future. We need to be able to understand what different professionals are doing so that our work is most useful to the populations we're working with, to our clients, to people in our neighborhood, right? So I'd love it if we could pop in the chat what school and discipline you're representing. So what's your academic institution and what is your field of study? As many people as can, even if you're on mute or have your thing off. If you can just pop it in there, it'd be great to see. So we have a pharmacy, Midwestern pharmacy student, DePaul nursing, Pacific College of Health Sciences, higher education and social work. What school is that from, Melissa? Northwestern, MD-MPH. Oh, Dominican, great. Stritch, medicine at Loyola, that's great. Another Stritch, medicine, great. Wonderful. So you'll see even on this call, right, alone, you see the array of differences. We have nursing, pharmacy, social work, medicine, health science. What is DACM? I know I'm going to make you type. I'm sorry. You're on your phone. She's like, I'm going to get it. Acupuncture. Fantastic. So yes, so this is exactly what we're talking about. This is pretty much maps on top of what our normal cohorts look like. So this year we have 11 schools represented: Adler, Roosevelt, National University of Health Sciences, Governor State, Loyola, Midwestern, Northwestern, Rush, University of Chicago, University of Illinois, Rosalind Franklin. I think I missed one, but those are some of them, which is exciting, right? Because you may have a sense of what's going on at your specific institution, but the city has a lot going on. And so having a sense of what's going on at different institutions is really exciting. Also, if you're in a specific program, you often get a good sense, as Olivia pointed out, of what the nursing landscape is like in Chicagoland or at your school. But what are chiropractic students learning? You know, what are folks learning who are in a pharmacy program? What does their schooling even look like? How many years do they have to be in school? Do they have to do a residency, right? Most of us don't know that, and that's okay. And it's exciting because in this context, we get to learn that. Together, we get a sense of what it is that the bigger picture of care and of service and of working with community looks like. What does that look like? And so the more you learn about what other people are doing, the better you will be able to be as a provider, as a part of your community, as somebody who works. The interdisciplinary part of Schweitzer helps you be even more involved with your respective fields. That is what Olivia just said, that I really think that that's true. That's something that we hear a lot from our alumni, and something that continues to be true as they go out into their fields. They're able to do their job better. They're able to connect better to others and to the people they're serving. So that's really exciting, and I wanted to highlight that. Are there questions at this point? Continue to pop them in the chat. We're happy to continue answering questions. We'll have a little time at the end as well for questions. So we've mentioned a few times this alumni network, right? This part. Chicago has graduated over 650 fellows in the past 24 years. And we have folks who continue to be involved from that very first class. We in fact granted a little bit of funding to a past fellow this past year to do continued community work, who was in our very first cohort. So 1995-96, that person graduated then, and they're still involved in community work. They decided to join our advisory council, and they're continuing this kind of work because it's a lifetime commitment to service. And it's really exciting to have that kind of engagement. We're also connected to the other chapters around the country. and are involved with the different alums all over. So it's really exciting to be able to connect. People often say that they'll go to, you know, a conference like APHA, or they'll go to a city and they'll try to find a different alum from this program in that area. We've had folks from our Chicago chapter move somewhere and find that there isn't a Schweitzer Fellowship chapter and start one. Like, this needs to exist in my town. So this is the kind of, you know, commitment that we see in our graduates. And it's also, you know, Olivia said, wherever you go, when people hear that you've been a part of this program, it's exciting for them because they understand the kind of commitment and the kind of perspective that you're going to bring to whatever you're doing. If that's a job you're applying for, if that's a different fellowship you're applying for down the road, that's something that opens doors and helps you be seen as somebody who has this kind of intention and this kind of commitment. We have a few examples of projects just to give you a sense that there's a lot of variety. So it's not a matter of, you know, you have to do one of these 3 projects or Olivia's project. You have a pretty wide range of options. The difference is that we're not doing traditional plug-in volunteering. You don't go there and say, I'll do whatever you want. You're creating something. This is your project. You have to think of something from start to finish. How will you initiate it? How will you get the word out about it? How is it that you'll evaluate it? We have support for you in all of that. We have folks who are professionals and have a lot of experience in evaluation who will come in and talk to you about that and help mentor you through that. But the process is a little different than traditional volunteering. And that's the place where you get to lean in and grow from that and learn from that. Some folks have done a lot of this in their past, and that's great. We love folks who have experience, and we love folks who don't have any experience. The point of this is that we get, you know, not only a variety of schools and disciplines, but also a variety of pasts, of experiences, of people's knowledge. So some people will come in with a lot of ideas about how this works, and some people will be learning, and that actually makes for a really rich cohort as well, and learning experience. We do not see this as charity work, and we're not looking to do charity work. We see it as an opportunity to learn from and teach at the same time, to empower communities and to leverage their assets and help them build what they want to see in their futures. And that ends up also mapping on and translating into the work that fellows do in their careers as well. So somebody who learns how to work with community is a better doctor. They're able to really connect better with their patients, listen better, understand the social determinants of health, the landscape that produced an illness that happened to a patient, right? So those are the kinds of contexts that really help folks be better practitioners, better providers, etc. Okay, logistics. We're gonna dive in to the timeline real quick to make sure that you have a sense of what happens when. February 1st is the deadline. That's a few months away, but it'll sneak up on you quickly. So the sooner you get started on it, the better. We are happy to help. And if you have questions, if you would like some feedback in advance of the deadline, we have a pretty rigorous selection process. So we want to give you the best chance that you can have. So we're happy to help review it. We don't sit around ourselves and say, we like you, we don't like you. That's not how this works. We have a committee, we have panels, we have interviews, the whole deal. So we're happy to give you the best shot by helping you develop a good application. And we've seen a lot of applications, so we can help with that. Applications are reviewed in February and March. In mid-March, we have interviews. Last year they were on Zoom. This year, or 2021, they will most likely also be on Zoom. But you'll be interviewed by a panel that includes alums of the program, that includes folks from our advisory council, and that really care deeply about this program and know it really well. So they'll just be asking more questions about who you are and what you bring to the table. Fellowships are awarded in late March, and then the program year begins May 1st with a weekend orientation in April. So it's a 13-month program, so that would start May of 2021 and go through the end of May 2022, which feels like a million years, but it'll be here before we know it. The way time is moving these days. What is time? So again, the links at the beginning of the chat have all the documents that you might need. I'll repaste them here. Documents including application guidelines, more information. We encourage you to take a look at all of that and also to be in touch with us. We are excited about supporting folks who are interested in applying. It's exciting to us to learn more about who you are and what your interests are. So this is us. This is our team. That's me, that's Rachel, and that's Angela. We all work on the fellowship, and we're excited to be in touch with you if you have questions about your application, about a potential project idea, about finding a site. Those are all things we can help you work on. Now we have some time for our staff and for Olivia to answer questions, or for you to ask questions of each other, you know, if you want. The chat is open. You can also unmute yourself and talk. We're trying to keep it pretty informal and fun and open, so don't feel like you have to use the hand raise function, or, you know, it's very open. So if anyone has questions, please go ahead.
Maya, I just wanted to update you. There's Rachel shared a new link. Do you want to put that in the chat for the? Yes. There's a Google Drive folder with all of the handouts. So. Oh,
I think is that not the one I put in here?
It's different. Yep, that one goes right to the FAQ, and the Rachel has one for the full folder.
Great. A better link is in the chat soon. Thanks for that.
Mm-hmm.
It's okay if there aren't questions. You can always think of questions later and get in touch with us, or or just access the documents. There's a lot of information in there. It's a really rich information. So thank you very much for being a part of this conversation and for being willing to share some things about yourselves. It's been exciting to virtually get to know you a little bit. And please do be in touch with us if you have questions. We'll send a follow-up. Oh, we have one hand raised. Go ahead.
I don't think we can hear you.
Let's see. Can't hear you yet.
There we go. Oh.
That's better?
Yes.
There, that works.
I had to take my earphones off. Sometimes they work, sometimes they don't. So let me.
No worries.
My name is Olivia, and I'm going to start off by apologizing for the background noise since I'm in a coffee shop. However, I just wanted to say, I don't have a question, but I just wanted to say thank you for the opportunity with all that's going on in the world, to still give us an opportunity to be a part of a collective, and to thank you again for coming on and taking your time with us. And I'm excited to just be a prospect. So yes, you'll be hearing from me.
Wonderful. Well, thanks so much for joining us. Yeah, that's great. It's true that we have seen this for our current fellows to be a space where they really feel, particularly in these wild times, to come together and really find, you know, folks who are interested in the same sorts of things they are, and to have conversations with and to build community with. So thanks so much for joining us. And again, we'll be in touch. We'll follow up with some more, with like some summaries of the different links and so forth in an email. And feel free, definitely everyone, to be in touch with us. Yeah, we really appreciated your questions and this conversation. Have a great day and enjoy the rest of your week and your weekend.
Oh, you're on mute.